Hello, and welcome to the Light Within Us podcast, where we share raw and honest experiences on topics affecting Kenyans and Africans. In our first season, we're opening up about an often silenced topic of miscarriage. We want this to be a safe space where women, their partners, and their communities can share real and heartfelt experiences. Our hope is that by sharing these stories, we can help those who've gone through or will go through a miscarriage feel less alone and more supported. We also hope that in sharing these stories, we can change the conversation around miscarriage and have a little bit more compassion in this conversation. I'm your host, Melissa Kiplagat. Let's begin. Welcome back to another episode of the Light Within Us podcast. Thank you so much to all the guests that we've had so far. I really do appreciate their vulnerability, and I've been loving getting the feedback from everyone who's been watching the episodes. I really hope it's helped you feel less alone. And today we have something that's a little bit different. We don't have a woman who has experienced a miscarriage, but we have a medical professional who I really wanted to bring along because as I've been interviewing people, I have a lot of questions. And obviously, I've had a miscarriage before as well, and I have a lot of questions. So I have someone here who's graciously given his time. I'm going to let you introduce yourself, what you do professionally, and then we'll get straight to the questions.
Thank you, Melissa, for having me. And thanks everyone who has been part of this great podcast. Dr. Chan Joak is my name. I'm a gynecologist by profession. It was indeed a privilege to be able to be part of this discussion. This is what likely basically we deal with on our day-to-day activities as we practice medicine and see how to basically help women be able to have a healthier lives. Thank you for having me.
Thank you. Thanks for being here. Okay, so first question, and this is just from a medical perspective. What exactly medically would you call a miscarriage, and how does it happen? Are there different ways it happens, or it's just kind of all the same?
So a miscarriage is basically is a term that was considered to be socially acceptable. It's removed the concept of stigmatization aspect of it, because it initially used to call it an abortion. That one has an element of stigma in it.
So medically, it used to be called an abortion.
Yes.
Interesting. Okay.
Yes, it used to be called that way. It has different aspect of it that most likely in the course of our talk we'll be able to talk about them. Yeah, so is when someone loses pregnancy. Generally, there are different bodies or societies that defines it at different gestational age or different month of pregnancy.
Okay.
So the most commonly accepted stage mostly is used in the West is around 20 weeks of pregnancy. When someone loses at that particular stage, it's considered as a miscarriage. Weeks. Yes.
Okay.
In the European society is around 24 weeks. And in the African setup is placed at around 28 weeks. But these days, the guidelines are changing to be more favorable to 24 weeks, or when you get a baby which is more than 500 grams. So it's considered someone that can be able to, with different interventions, can survive in a way.
Oh, yes. Okay. So if you have a pregnancy loss after, let's say, 24 weeks, what is that called?
It's basically a preterm delivery or a preterm loss, something of that.
So it has a different name.
Yes.
Okay. What are the warning signs that something is wrong when you're pregnant, that you may be having a miscarriage? And is there anything that we can do?
So mostly there's some basically pregnancy symptoms that are supposed to be associated with the normal growing pregnancy. Most of the time is manifested by morning sickness, where there's nausea, there's vomiting, and generally being weak because of such kinds of things, and a sense of bloating because of there's a hormone that is called HCG.
Yeah.
The one that basically sustains the pregnancy from its earlier part, that helps in the production of progesterone.
Okay.
Basically, it's produced by a certain cyst that the place where the eggs come out, it forms a cyst called corpus luteum.
Okay.
Is able to produce that hormone until the placenta takes its effects around 11 weeks, so that it could be able to. So earlier part of pregnancy, it always a little bit high and it produces those kinds of symptoms. So someone, when you have those kinds, you know that at least your pregnancy is progressing well. So sometimes such kinds of symptoms disappears. They don't appear basically. So it's basically a sign that the pregnancy is regressing in a way and it's not growing though it's ought to be.
So if you had nausea and then you just stop having nausea, that's not a good sign?
Generally, yes. Though a few individuals might have that and really nothing much is wrong. But for the general population,
if your symptoms stop.
If the symptom stops, it becomes a problem. And sometimes it can have some vaginal bleeding. It may not be much, but it's something that could be. Other individuals, they could also present with low abdominal pains. Yes.
I have a question about the bleeding. Yes. Because I've seen that there's some women who are just like, well, I have a period while I'm pregnant. Like they have bleeding and their pregnancy is okay. What is that? And how do you know whether that's what it is or there's a problem?
So usually when someone has confirmed that they are pregnant and any bleeding during pregnancy is not normal, there could be something that's going on. There's a common occurrence where there's some bleeding under the placenta. It depends on how big is that bleeding. It could also be a threat that could result into pregnancy being lost.
But not always.
Not always. Most of the time it resolves. So if you happen to come to hospital and we happen to check, there are different percentages that based on the amount of bleeding that could be seen under the placenta that is able to make us basically know the different intervention that we could do. There are some medications we give just to help in relaxing the uterus so that the body is able to handle that particular aspect of bleeding. And most pregnancies are progressed normally without issues, even after having such kinds of bleeds. It's just a few that results into losses.
So if you're, because in my situation, like I had bled for like maybe 4 days, 3-4 days before I'd lost the baby. So is it all situations of bleeding, it's repairable? Or are there some like if you're bleeding, like you're just going to miscarry? Or all of them, like if you come in soon enough, we can help, if that makes sense?
It depends on the finding that we get. Mostly when someone comes with bleeding, that earlier part of pregnancy, we do an ultrasound that gives us basically the outlook of how things are.
Okay.
And depending on the findings, it would be able to help us guide on the prospect of whether this is a kind that is not resolvable in any way.
Yeah.
Or this is the kind that we know that if we do one intervention or another, the person will relatively be able to proceed.
So you're saying if you have loss of symptoms, like just out of the blue, or if you have bleeding, you just need to get checked?
Yes.
Is there anything else that, like, if you see this, you must get checked?
Maybe abdominal pains.
Okay.
Yes, is also one of the symptoms. Like
cramps?
Yeah, the cramps, yes.
Okay.
Yeah, it's not really that common, but it does happen sometime for some people.
Okay.
Yes.
Okay. I know there might be a lot of answers, there might be no answers to this, but why do miscarriages happen?
So what has been medically found is that around 60% of miscarriages occurs because of chromosomal abnormalities. So you find that in the formation of we call it fetus in our languages, but I think let's use the common word of a baby. Something goes wrong at how those chromosomes, basically, they are the building structures of our genetic material that results into our being formed the way we are. So when there is some mutation at such particular levels, it results into the baby not being formed. Failure to that would make sure that everything else about pregnancy basically would find a way of not progressing. So around 60% of those miscarriages, they are that. Most of the time, in our African setup, we don't always do that. But in other places, when someone had a miscarriage, genetic analysis usually done just to
We don't do that here at all?
It is done within Nairobi. It is done. It's just that most of the time it takes sometimes. Some of these things we send them abroad, but it's done in Nairobi. It's just that it's not the common practice.
Yes. Okay.
Yeah, but that is the ideal, basically, just to help to get to know. It helps in planning the next pregnancy. Yes. And
wait, hold on. It helps planning the next pregnancy.
Yes.
Why? What's the link between this pregnancy and the next?
So depending on whatever you found, if maybe you did genetic analysis, there are some that could recur.
Okay.
Yes. So
from the testing, you can tell this is something that will probably happen again.
Something that could likely contribute to you losing in the next pregnancy. So that helps us plan and get to know what are the different things we could do to make sure that the next pregnancy does not really get to have a problem. So apart from that being the major bulk of things, there are also many other things. Chronic conditions like having high blood pressure, which is not well controlled, diabetes, which is not well controlled. There are some autoimmune condition or connective tissue diseases, or some people have blood disorders that could also result into all that. And then there are also some, we call them anatomical or structural problems with the uterus.
Okay.
Yeah, that could also be able to contribute. Other things like fibroids, and there are other tumors we call adenomyosis, or anything else, like if someone has an endometriosis. Yeah, things like those, they basically all contribute to all that. But the bulk of cause of miscarriages is basically things to do with chromosomes. And there's also the aspect of the physical structure of the cervix. Some people have weaker cervix, and those kinds of losses, they happens around the 6 month.
A weaker cervix, is that something you're born with or something that happens?
The main issue mainly is we could say something that someone is born with, or the other time is if someone has had a trauma on the cervix that also weaken the integrity. There's the element of someone being born with, it has to do with this what is called collagen, the kinds of fibers that makes the tissues.
Yes.
Sometimes there's some deficiency in some type that usually composed of that, and that could result into that being weak.
Got you.
Yes.
Okay. I actually wanted to talk about fibroids because I've had two of the women that I've talked to. There was Catherine in episode 6 and Angela in episode 2. They had fibroids.
Yes.
And that's something I think before I did this podcast, I'd not really thought about, heard of. I didn't have fibroids myself. Is that something that's very common with women?
It's very common, especially in African Black women.
Why African Black women?
What has been found is genetically there is a gene mutation that is called MED12 that is more predominant in the Black race. That one is it is prone to having mutation, and that one, it results into fibroids being formed. So it's common in the Black race, especially in African women. So you find that fibroids are quite common here. Basically, they're benign growth. They're not cancerous.
Yeah.
Yes, it takes also a very long time for them to form.
So a lot of time, do you find that a lot of women, they've had them, they just don't know?
Yes. The individual does not really get bothered until when they start causing symptoms. And usually, even when we find them when they are small, we don't do anything much about them.
You don't do anything about them?
Yes, unless when they become symptomatic or cause problems for the individual.
Okay, but is it a big factor in, like, is it a big, if you have fibroids, is there a very significantly increased chance of miscarrying?
Not necessarily. It depends on their size and where they are located.
Okay.
So fibroids in the muscle of the uterus, there are 3 places that they may likely be in. And it also depends on their size. The uterus have an inside layer, it has the muscle layer and the outside layer.
Okay.
Yeah, so the one that are outside, on the outside layer, they really don't cause much a problem, unless when they become too big, where they are able to cause basically symptoms to the person and not mainly of the pregnancy. People have fibroids outside the uterus. They usually don't have an issue with the pregnancy as such. It may just be the pain, because as pregnancy grows, the uterus also becoming bigger, and these fibroids are also becoming bigger. They have a tendency of responding to estrogen and progesterone. They have receptors. It helps them to grow. So in pregnancy, because these hormones are at a higher level, it's also, the increase in size. Yes. Yeah. So the one that are usually problematic for pregnancy, they are mainly the one that happen to be inside the uterus.
Yes.
Those one, they give a mechanical obstruction, or they could actually make it difficult for pregnancy to be implanted.
Yeah.
Yes.
And then I remember, I think it was Catherine who was telling me that she had surgery to remove the fibroids.
Yes.
And then her doctor was like pushing her, like, you need to get pregnant again quickly.
Yes.
Are fibroids, do they have a high reoccurrence rate? Like they will normally come back? They
do recur. And then the other element to it is that most of the time we don't remove all of them, because it depends on the sizes.
Oh, so even if you have the surgery, they'll still leave some in there if they're like small?
Yeah, because sometimes it becomes a bit difficult to get some very smaller ones.
Okay.
Because it is a surgery that involves a lot of bleeding.
Interesting.
So sometimes when the size are very small and they are in many places, it is not worth doing. Usually just remove the bigger one so that the uterus still remain with its integrity.
Interesting.
Yes.
Okay. All right, getting back to a miscarriage, like let's say a woman is experiencing a miscarriage. Is an ectopic pregnancy also a miscarriage?
No.
It's not?
It's not a miscarriage.
Wow. Explain.
It's an ectopic pregnancy.
But I'm like, because my reasoning would be you're still losing the baby.
Yes, it's true. Your reasoning is right, but it's not.
Oh, scientifically, it's not
a
considered.
Miscarriage. No, it's simply a pregnancy outside the uterus. Yes, mostly it happens on the tubes or in the ovaries, but it can be anywhere. It can even get itself in the liver, in the liver. Yes. It can even plant itself on the muscles.
I'm going on a tangent because I'm like, how does it get to the liver? What? Oh, what? Have you ever seen a case like that?
Yes.
Of a pregnancy in the liver?
We have. And in fact, they managed to actually get to term with delivered the baby.
You're joking.
Yes.
And it stayed in the liver the whole time, or you moved it?
No, you don't remove it.
Are you being serious?
If it happens to be known earlier, we will do an intervention. But there are some that we have seen that the mother's not been going for the clinic. She's just knows she's been pregnant. She comes to you at the point of delivery and you found that the pregnancy is not in the uterus. Yes.
Oh my gosh. Yes. And the baby survives and the mom survived.
Yes, they do. Yes, they do.
I've learned something.
There are very few and rare ones, but pregnancy can be planted anywhere. So,
but an ectopic pregnancy, is it... So that's anywhere. So even the one in the liver, that's an ectopic pregnancy.
Yes, it's an ectopic pregnancy, yes.
That's interesting because I always assumed like an ectopic pregnancy, it happens in the tubes or something, but the child will always die. And like you have to get it out.
Yes.
So you don't always have to get it out, depending on where it is.
Yes, depending on where it is and at what stage the individual comes, For us, if you came to us earlier and we found it to be not be in the uterus, we will certainly intervene.
Intervene meaning
Yes,
remove the pregnancy.
Yes, remove it, because it's a great danger to your health.
Yes.
Yes, we need to have you safe. That's the thing.
Guys, people are having babies in their liver. That's insane. Okay, sorry. That's really, wow, that's very striking. Okay, so going back, someone is having a miscarriage. Let's say a normal,
Yes.
if there is such a thing as a normal miscarriage.
Yes.
What is normal for them to expect from that experience? And let's say they're having a natural one, they're not doing a DNC or anything.
Yes.
And what is abnormal, so that if they're at home, they're like, hey, if this is happening, you need to go back to the doctor.
So a miscarriage, it has different classifications, but the most common and what we could call basically normal is we call it spontaneous.
Okay.
That comes out by itself.
Yeah.
Whatever is the cause is still a different story, but we just know that the pregnancy
has ended,
failed to develop, and started to come out by itself, and everything came out. Such that by the time you come to us at the hospital, you came reporting of bleeding. You can be able to describe the nature of it. And then once we are able to do an ultrasound, we find out that inside the uterus, everything has come out.
Yeah.
So we call it a complete spontaneous miscarriage.
Okay.
Yes. Because apart from that being, once you check that hormone I told you, HCG levels, it shows us that actually you are pregnant, and this is the process that has transpired. So most of the time when someone comes and we found that everything has come out, apart from giving them pain medicines, just to make sure that they are comfortable, we don't do anything else.
So in that situation, like, I would assume, okay, also from my experience, you'd bleed a lot.
Yes.
Okay, let me just make it personal. So for me, like, that moment, I guess, of expulsion,
yes,
I was bleeding a lot, but it wasn't for an extended period of time.
Yes.
Is that what is normal? Or if you can still bleed a lot for like a day, 2 days, 3 days?
Everyone has a different experience altogether. For some individuals, depending on what triggered basically the whole pregnancy to come out, it takes a shorter period of time. Others, it takes a longer time, which results into them bleeding more, and that could result into other things about losing their blood and becoming anemic. So that also becomes a different story. But
so if you're experiencing,
it depends also at how many months the individual is.
Okay, so the further along, you'll probably bleed more.
You will bleed more. Yes,
because I'm just thinking, like, there are a lot of women who choose to have their miscarriages at home without ever going to the doctor.
Yes.
Is there like a cutoff period where it's like, if you've been bleeding heavily for like 5 days, you need to go see someone?
What we usually say is, you really don't need to stay at home for a very longer time. If you happen to have bled significantly, let's say, we would encourage, if someone chooses to just stay at home, there's these pads, get the maternity pads. They are there in the supermarkets. You can buy them either even in a chemist. They give us a picture of how much blood someone has lost. So we usually say if someone changes those pads, like 5 of them in 2 hours, it's a significant amount of bleeding. You need to come to hospital, because
5 in 2 hours.
Yes, you could actually bleed to a state that you would be incapacitated. So we really do not want you to get to that particular point in time. Yeah, so for some people, it could prolong for some time and takes a number of days. But as long as not that significantly much, it's still manageable in a way. But usually we encourage that individuals find ways. Sometimes you can come to the hospital and we find that there's the other aspect that you've lost the pregnancy, but not everything has come out.
Yeah.
So it depends at what age of pregnancy or at how many months. So most of the time when someone loses pregnancy less than 10 weeks, we don't most of the time admit them.
Okay.
Just give them some medication to help remove the rest of the whatever has remained.
And that medication, that's the one that makes the uterus contract.
Yes, to contract, yes.
Okay.
Yes. So also, we're usually keen when we are sending someone home. We also need to put in many factors. Is this individual someone that could be able to access hospital when necessary? Are they in a position to?
Yeah.
And we also need to put in. So for us, we don't make decisions for people. We inform you about the better option.
Options. Yeah.
So the decision is yours. If you think that going home will not be really ideal for you, we will be able to admit you, just give you that particular medication while you're with us, and then we see how things go.
And then
which would be preferable if the individual is willing to, yes.
And then where do DNCs come in?
Yeah, so there are two ways to approach it. It is acceptable for any of us to choose to say, I don't need to give you the medicine. I just need to take you to theater and be able to do the DNC and finish with the aspect of bleeding.
In which situation would you choose that? Would you choose that instead of the medication?
If the individual has bled much, you won't give them the medication, because already when they have lost significant amount of blood, they're getting into anemia, and that comes with its own problems. So to make sure that we stop the bleeding and complete it at once, we take you to do a DNC. That's usually a straightforward or if the person we call hemodynamic, where not stable. Let's say the blood pressure is not okay, your heart rate is very high, maybe you have for some setup where there is fever, which is usually unlikely in most of the times. Yeah, and you are not generally stable, so we can't give you the medication. You just need to make sure that the source of where the problem is needs to be done away with, so that you can be able to settle and be stable.
Do you feel like, because in my episode, I think if people have heard my episode, they know my experience of a doctor pushing a DNC on me. Do you feel like, and actually quite a few of the women I've interviewed had DNCs, do you feel like it's overprescribed? Like there are women who are given DNCs and they don't actually need them?
I would say not necessarily. It also depends on the individual that you had gone to, because the doctor, yes.
So there are some doctors
who some that would prefer that, and sometimes it may just be the right thing to do, because is actually a final solution in a way in the setup that you've been able to come to. But sometimes it's quite a challenge, because it has its own complications in itself. So it also needed to be done in a setup where everything is being done well, and the individual is also aware of the risk of what could actually come. Because by the time that you are doing that, you also need to make the individual know what risk does it involve to actually be able to do a DNC. So it's something to look into and be able to come to a place of such an understanding. Sorry that if you felt like you are being caused to agree.
Because in my situation, I went to a doctor and she was pushing a DNC, acting like, oh my gosh, like I wish you'd come to me earlier. We would have done it today. And at this point, I wasn't bleeding a lot. And she was saying, okay, yeah, there's a little bit in your uterus left. And she was like, there's no way it's going to come out because your cervix is closed, all this stuff. I took the same ultrasound to another doctor the next day, because I was like, something is not sitting right. And he was like, you're totally fine. You need pain medication, but you'll be fine. And sure enough, like whatever was left came out. And so I was just like, why are you pushing? Because it's a surgery.
Sometimes
and there was no need.
It depends also. If you're not bleeding, just like you said, so there are different ways to approaching it. You could either just observe. Most of the time, if the amount within is still very small, it would just come out by itself.
Yeah,
it's just time that is required. Just need to make sure that you are not disposed to actually getting infection in the course of time.
Yeah.
So those are things that usually you need to be able to put into picture altogether and be able to come. Just like I said earlier, I think the best approach to practice that most of us do have is that we don't make decisions for people.
Just give options.
We give you the rightful information.
Yeah.
We could suggest that this would be the best for you, but you're still free to be able to choose.
Yeah.
To be able to say this is that. It's only in some setups where if it's truly a dire emergency, we know that if we leave you to your options,
you'll hurt yourself.
It is going to be harmful,
decision.
And we will not want to be in such a situation. So at such setup, we become a bit more towards deciding and saying that, no, this would not be helpful for you.
Yeah.
Neither would it be for us as practitioners, because we are here to do the good that we are able to do.
I have a question about DNCs.
Yes.
From the women who I've interviewed who have had DNCs.
Yes.
I think almost all of them have told me that they had DNCs without any anesthesia. And it was one of the most painful things they've ever experienced. Why? Is that common?
It's common, but it's unfortunate. It ought not to be so.
So they should be under anesthesia.
Yes, they should be. It's unfortunate that's happening that way, but it's common in the public setup.
Public hospitals?
Yes. If you go to the main Nairobi private hospitals, they won't do it without anesthesia. It's not going to happen.
But I would assume there are other surgeries that even you are done in public hospitals, but they'll always be given anesthesia. So why is it DNCs are the ones that they're like, we don't need it, and it's still a surgery?
I won't give you a solid answer, but that's the rightful observation.
But it's wrong is what you're saying.
Yes,
it should not be that way.
It should not be that way. But that's what is being practiced, basically. But it should not be that way. Yes,
that's
because
insane.
It involves pain.
Yeah.
Yeah, but that's what's happening.
Yeah.
I think maybe just people think that is a bit quick and...
how long does it take?
It depends on who is doing it and...
on average?
30 minutes or less.
Hey, 30 minutes without anesthesia. Yes. That's not fair.
Yes. So sometimes fair. I think what I've seen being done in public hospital is they give some strong analgesics.
Uh-huh.
Yeah, they really completely don't remove the pain, but it relieves it a bit, yes. Hey. But the ideal setup would be to put anesthesia.
Okay. Sensitive question. When you have a miscarriage that happens at the hospital, because I've heard some horror stories. The baby comes out. Obviously, they're dead. What is the procedure on what you guys do with the baby's remains? Is there an actual procedure? Like, what are you guys supposed to do with that?
Yeah, so the primary thing to do is the mom or the owners of the person will decide what to do with the body.
Okay.
So usually most hospitals, they have already a structure of, there is certainly a place for those that don't want to go with the body of the baby. Where
and when
that
they don't, what happens to that?
Be done. There is, mainly there are places where they bury.
They're buried?
Yes.
Okay.
Depends on how long. Yes. So, some hospitals, they developed a place, a protocol, or let me say that way, that if you don't want to go with the body, it is called, the hospital will dispose.
Yeah.
Yes. But I know at a certain hospital where they actually bury those bodies.
Because I've heard stories that I find horrific.
Yes.
Of like a woman miscarrying, and then they just leave the dead baby there with her.
Usually it is the choice of the person. Some do prefer
to be left with the baby there.
To have the baby with them. Others don't.
My question is, obviously, like if you're sibling, God forbid, if your sibling was to pass,
Yes.
they wouldn't just like put the dead body next to you and just be like, okay, just look at it all day.
I think the hospitals have different protocols of how to approach such a circumstance.
Yeah.
But most of the time, for someone to actually be placed next to, it's always the mother's preference.
Request.
Yes.
I've heard stories where it's not her request. Let me ask a question. If the child is born and then dies,
Yes.
like born full term and then dies like a day later or whatever,
Yes.
Are they the same protocols of what is done with that baby?
Mainly, let me say this. I think usually that is the decision is basically for the people of the baby.
Okay.
Yes. Especially someone that is born and then somehow, for unfortunate reasons, ends up dying. Usually, family goes with them.
Yeah.
Yes, usually.
Okay. And then kind of my last question. A lot of the women I've talked to on the podcast, me included, and also just women in general who I've talked to about their experience with miscarriage, talk a lot about the insensitivity
Yes.
of doctors, of nurses when it comes to a miscarriage. And in my episode, like I mentioned how when I was doing the ultrasound and the person doing it was just like, Isha Toka, like it was just a thing or something. But a lot of women have mentioned that insensitivity. Number one, do you guys get any kind of insensitivity training? Not necessarily even about a miscarriage, but about a child's loss? Or is there a reason why there's that callousness, shall I say?
Let me say, it's unfortunate it's happening that way, but that state of callousness that you've seen, it's simply a picture of our society.
Uh-huh.
Not being able to respond sensitively, because we would say is an individual problem, but it is prevalent as rightly observed.
Yeah.
It does happen. We need to be cognizant of that and agree that this is the problem we are facing.
Yeah.
It's unfortunate that's happening that way. Some different institutions, they have a structured way of approaching such a loss. Others have some committees that usually when an incident like that happens,
Yeah.
they are triggered to be able to attend to that. And some hospitals, basically, they even have a different setup, a different place where they put such
Those
people who have
people.
lost their babies at such an instant.
So when you're in training in school as a
Yes.
doctor,
Yes.
there is no training per se on like sensitivity. I don't know what you would call it, but something like that.
I think something that is close to that would be bereavement management in a way, or how to handle
Bereavement
grief,
management.
how
Okay.
to handle such a thing. The challenge that we face is if you don't practice that, whatever you have trained with, often you have the normal tendency of human beings not being able to do the thing will just set in.
Yeah.
But I would say the insensitivity that is observed is there, and it's unfortunate that's happening that way, but it's basically a general picture of how we even approach such things as a society.
Yeah.
Because it's basically an individual issue. Not everyone will respond that way.
Yeah.
Yeah, but it's
But it
something that,
happens.
it does occur. And we have to be cognizant of that and say,
Yeah.
it's not right in itself, but it's what's happening. So I think there's more to be done.
Yeah.
And see that this is not the way, because even if it's not just this particular loss of the baby, there are many different griefs in this life that needs us to be able to support an individual. Yes.
Okay, so I lied. I have two more questions.
Just feel free to
Number
ask.
one, what do you wish, as a medical professional, knowing everything you know and having the experiences that you've had, what do you wish more people knew about a miscarriage? And number two, what would you tell women experiencing a miscarriage right now?
So your first aspect of the question is, what would I wish to?
What do you wish more people knew about miscarriages?
Yeah, so I think it would be good to, especially for women, to know that miscarriages do happen.
Yeah.
It's a common occurrence. You find that it is at a higher percentage that every woman in her journey of reproduction, she will lose a pregnancy.
Actually, sorry, what is that percentage? Like, how common is it?
I don't have the numbers now, but it's quite common. Yes, it's quite common.
Would you say like half of women will
It could be.
experience
It
that?
could be. It could be more than 50%.
What?
Yes.
Wait, it could be more than 50% of women.
Of women, yes.
As they're trying to have a child, will lose a child.
Will lose a pregnancy.
What's the rate of losing more than one?
So having lost one predisposes you to lose more.
God forbid.
Yes, it's a risk in itself. Yeah, but usually it's always necessary to try to find out what exactly could have been the cause. And the stage at which you lose that pregnancy also play a key role, whether it was 8 weeks, 14 weeks, 20 weeks.
So the later you lose it, does it make you the better?
The better. It still gives you a greater chance that you are going to carry a pregnancy. The earlier you lose it, the worse it is.
That's so scary.
Yeah,
oh my gosh. Okay.
I'm trying to keep track of our two questions.
Yeah, what do you wish more people knew?
Yeah, so
it's very common.
Yes, it's very common. The second thing that I would say about it is people need to go to hospitals when you have such an incident because I don't advocate for home management. At least let you be seen by a professional.
Even if you've had one before and you know what to expect.
If you had one
every
before,
time you should.
Yes,
okay.
It would be important because other things could happen which are not really, it could be prevented if you are being seen by somebody. Okay. That would be very important. And if you happen to have lost a pregnancy, as much as we know that it's a risk for the next loss, once you get pregnant next time, we'll say go to hospital early. Yes, so that we could be able to follow the pregnancy a bit closely. If there's any need for anything to be done, that would be done, just to make sure that we prevent the same problem recurring. Yes. The second aspect of the question was?
You've kind of actually answered it. Like, what would you tell a woman having a miscarriage right now? Number one, go to a hospital.
Yes.
Like, get seen. Anything else?
I don't know. Had you written it down? Because I think there's more to that.
No, it was just, what would you tell a woman experiencing a miscarriage right now? Then the other one was, what do you wish people knew?
Yeah. So they need to be able to go to hospital and get to be checked.
Yeah.
Yes, let's follow you closely. Even if you are to lose the pregnancy, we'll be able to see how we will be able to help you in one way or another. Yes. This day and age, most of us, they would give you the support you need because we understand that it's not just a physical or a mechanical thing. It's a psychological issue in itself. It's a social issue where we are able to support you even as persons. We will be able to do that because first we are humans and persons before we become doctors. We need to also have to understand that because even we ourselves go through the same problems in one way or another. Yeah. So if you find someone that has not had that incident, there's likely a sister or a cousin or a niece
statistic.
Was had such
maybe
an
over
issue
half
altogether.
Yeah.
So that is something that I would tell a woman out there. Don't feel isolated.
Yeah.
You can still get support even at the different places that there is.
And there's still hope to have a successful pregnancy.
There is hope to have a successful pregnancy. If you've had such difficulties, just find a way of getting a practitioner that you could be comfortable with to be able to walk with you and see what other thing could be done
Yeah.
to make sure that at least you go home with a baby.
Yeah.
Yes.
Fair.
Yes.
Okay. I think that's all. Do you have any last words? I'm done with my questions, I think, for now.
I would say,
yeah.
Thank you so much for this
Thank
particular occasion. And I would want to speak to the women out there that we are here for you in whichever capacity that we could.
Yeah.
We will be able to do what we are able to professionally and also support you in whichever way that we could.
Yeah.
Don't be afraid to go to hospital. And I would encourage you, if you're not comfortable with someone, please feel free to seek the next opinion. It is still your right.
That's very important.
To be able to get the comfortable care that you need.
Yeah.
Feel free to go to the next person. It will not be offensive in any way. This is your life. You have a right to live it the way you feel comfortable.
Yeah.
So the rest of us are part on your journey of living your life. We're able to facilitate the best way you could.
Yeah.
So don't feel trapped at one particular point to say that this is the end of my story, and feel free. It is okay to be dissatisfied. So don't feel as if guilty in any form that maybe you are leaving this person in one way or another. No, it is your right primarily, leave alone what the other person will think. So please take control of your life and feel free to exercise it where you feel.
Yeah. It reminds me, I don't remember which episode that I did where, God, I wish I was remembering the name correctly, but she, like, after each I think she had like 4 miscarriages. After each one, she changed doctors. So yeah, ladies, yes, if you don't like your gyna, just find another one. It's okay.
Yes.
Thank you so much for coming. Thank you for sharing your insights. I've learned very many new things, that you can have a pregnancy in your liver. And that to me is the most shocking thing I've heard. And almost maybe over 50% of women in their journey might have a miscarriage, which is a huge statistic. But thank you so much. Thank you for sharing the knowledge. I've learned a lot. I'm sure our listeners have as well. And thank you to everyone who's listened, and I will see you on the next episode.